The question is, where did Nigeria and even Nigerians miss it in the case of Lassa fever? Some experts believe that many reasons, including poor hygiene, traditional way of food preservation, bush burning, and even myth in some cases are all responsible. Late last year in Munya local government area of Niger State, residents woke up to strange death in their community unknown to them that it was a dreaded disease known as Lassa fever. Recent outbreak of Lassa fever is coming at a time the country is still celebrating the end of the likes of Ebola and polio diseases. The hemorrhagic fever caused by a species of rat is now becoming a seasonal epidemic, especially during the Harmattan period. Niger State recorded 19 deaths and has the highest death out of the 16 other states affected in the country.
It happens all through the year, but more cases are usually reported at the beginning of the dry season when you have bush burning. Okay. Now, other factors that seem to have allowed the disease to spread around is the habit of drying our foodstuffs on the roadside. From Lagos to Sokoto, from Port Harcourt to Portisco, you will find on the roadside foodstuffs, that are put there for drying. The rats also go there to eat and contaminate those foodstuffs. Okay? Now, those who hunt for rats, especially those who prepare it for food, okay, are also affected because, of course, they don't know which type of rats carries the infection or not. So, in contact with the blood of rats, they also get infected with Lassa fever. So what we're talking about is a viral infection, highly contagious, affects human beings, and can spread from one person to another. Even health workers that have not taken adequate precautions in attending to Lassa fever patients can also be affected by the disease.
The hemorrhagic fever is not only a Nigerian public health problem, but has also been reported in other African countries like Guinea and Sierra Leone, with the current outbreak only in Nigeria. If not for any other reason, this fever has made Lassa village more popular than any other village in Borno State, as it was first reported there many years ago. Health experts say to contain an epidemic outbreak such as this, contact tracing is imperative, while quick presentation and intervention can make much difference.
50% or more Nigerians know what to do and can pass healthy information to others. There will be very little problem. In Niger State, and the minister said so last Wednesday, the biggest problem was they were building a market in one village. And when people started falling ill, they said for the market to survive and prosper, people have to die. And if people don't have to report it, that's a traditional belief. And if you report it, you may be victim of the death. So they didn't report the case until a long time. Something that started in August was only reported at the end of December because the child of a school principal was involved. So he reported it. Those kind of things required more response than government workers, society, and things.
Government has frequently reassured Nigerians that there is no cause for alarm as the situation is under control, while the sector vaccine continues and drugs are being distributed to affected states.
Given the situation every day, we are appealing to people that it is better to assume that it's Lassa fever and then say, sorry, it's not Lassa, than to say, oh, it's malaria, but then after that says it's Lassa. So we expect that with active case finding, a heightened level of awareness, more suspicious cases will come up because we are now searching for them actively. We have the drugs, and we also have protection equipment, which we are sending to all the affected areas. We are sending our field workers out to be on alert and search for more cases. And we're also developing jingles and strategic communication with states and everybody. We are saying, look, please tell everybody that this problem is real.
Government is seeking ways of adopting a rapid test diagnosis at the point of care to test any suspected case to save frontline health workers and reduce the spread of the virus.
That the patient has Lassa fever. There, by the bedside, you can do a rapid test that can tell you that what you're having as a patient is probably positive for Lassa fever. Okay? But that test could also has to be confirmed, in a laboratory. Because it's a rapid test that also needs to be confirmed in a laboratory. But that tells you what you are dealing with,
Intensified surveillance, training for health workers, and drugs for affected states are all government's quick response to address this situation. While only 6 out of the 9 laboratories are functioning, the National Center for Disease Control says it hopes that others will start working soon.
No, it's just late reporting because the laboratories are scattered in the different zones. So, and they can take the information of the patient to those the samples in those laboratories all within 24 hours for now. But we intend to increase more. We have 9 laboratories, out of which 6 are testing now. But all the 9 have the capacity to test. If we have more reagents, they should be able to do it.
A 4-man fact-finding committee to 3 affected states of Kano, Bauchi and Niger has been set up.
These are the frontline states to find out causes of delay, because there's definitely delay in the occurrence of the notification of the disease to state and federal government so that action can be taken. Surveillance and notifying disease is the heart of capacity to control. So once information doesn't come, you don't take action. So to find that out and find out any problems they had with what needs to be done, okay? And then
the war against Lassa fever requires a multi-sectoral response, experts say. However, government determination to halt the spread called for an emergency council of health meeting held in Abuja with over 400 delegates in attendance to facilitate discussions towards controlling and managing the outbreak.
Lassa fever in Nigeria, but it's not the highest. We recorded 2 cases of Lassa fever. We have other states that have a much higher number. But that aside, Kano State is doing very well. It has put in place measures to prevent and control the spread of Lassa fever in the country and in the state in particular. Part of what we are doing is we have set aside a facility, a treatment center for isolating cases of Lassa fever. And apart from setting aside the center, we have provided equipment, drug, and other personal protective gadgets that will be used by healthcare workers to protect themselves. And additionally, we have provided an ambulance for transportation of, cases and suspects from the community to the center. Apart from that, we are embarking on mass sensitization of the community and healthcare workers.
So we have shared the experiences particularly from the affected states. So they have given us the rundown of their management protocols, so that when we get back, we are going to widen our scope to make sure that, first of all, that we prevent all the arrangements in making sure that the disease doesn't come in. And even if accidentally comes in, we should be fully equipped.
Lassa fever can be treated, but it's also wise for the general public to do the needful by ensuring personal hygiene, such as simple hand washing practice, environmental hygiene, and on the government's part, continuous awareness as well as sensitization.